through a blood flow restriction training workout for the upper extremities, specifically for the throwing athlete. So we got the cuff here on Austin. We're just gonna find his occlusion pressure that we want to take him to. For him, we're going to take him to about 65% today, 50 to 65, depending on how he feels. So we always use our ultrasound gel and our Doppler here to find our occlusion pressure, because we want to be very specific here. We got the cuff already on him. For Austin, we had to use the smallest size. I'm kidding. You want to measure the size of the arm of the athlete first. Make sure you got the right size cuff. I always put a little bit of the pressure in to start. Once we got just a little bit of pressure in to the cuff, it'll help us find. We're gonna look for his radial artery here. Right there. We're gonna hold that. We're gonna go until we feel it disappear. Going up at about 10 millimeters of mercury. And we're gone at about 120. So I'm gonna release, we'll relocate and attempt again. $118. So we get 118, 120 milligrams of mercury. I let the pressure off for a second, power this down, grab a quick towel, the ultrasound gel here. Okay, then we're gonna take him to 65 to 50% of that, see how he feels. So 120, we're gonna be sitting, we'll try him around 76. Once I get it filled up with some pressure, I'm gonna have him do a couple just bicep curls, just moving the arm all the way to extension. That'll help move the air throughout the cuff. And usually we'll see a little drop there. You wanna make sure if you're doing this, you're not doing it on your own, you're doing it with someone who's been certified. This is just a demonstration to show you guys kind of some of the things that we might do and talk about why this might be important. So once he relaxes, just let your arm relax. And we saw it drop about 7. So we'll take them up just a tad, a couple more bicep curls. And then you gotta make sure they're totally relaxed so they're not exerting any force or any contraction. Relax your arm. Because this is a phenomenal way to load an athlete with a lighter load, but still get hypertrophy effects, still get strengthening effects, and also to improve healing rates. And there's some really great research that I encourage everyone to look into with blood flow restriction. We found it to be super effective in improving how quickly athletes can recover, but also in hypertrophy rates with athletes who we may not be able to load at a level that would allow them to have any sort of muscular performance or physiological improvement in the muscle. So great little strategy here, which is using this in the beginning stages. I don't do it a lot in the later stages, except for recovery, which we're gonna show you guys in a later video. So with that said, we're gonna go into a quick workout. For this BFR workout with Austin here, we're gonna go through 3 exercises to strengthen bicep, tricep, and then the medial and lateral forearm musculature. Super important for a throwing athlete. Anyone with golfer's elbow, tennis elbow, those things as well. On the medial side, lateral side, either way, these are some good exercises to do there. We can load them up without putting a lot of tension or tensile load on those structures. So from here, we're going to do an isometric bicep activity. So he's in an isometric bicep contraction. He's going to do a lateral step away from the attachment point with the band, and then back, and come on back, and then out again. So for this, we'll do 3 sets of 10. This is a prolonged isometric. I want his elbow as high as his shoulder or just higher, 90 degrees of elbow flexion. So a perfect 90-degree angle here. So it's a 90-90 bicep activity. And I don't want him super far out to the side. So with Austin, you can see he's slightly in front of his chest with his elbow. He could be a little bit more. and you want to make sure your form is good as you continue. You'll notice with BFR a ton of blood pooling in the muscle and a lot of burning, a lot of that lactic or lactate buildup that's going to cause some burning in the muscle, which is a good thing. But, you know, we're keeping in mind tissue reactivity, patient reactivity, the acuteness of the injury, strengthening in the correct ranges, all of those things. But our typical rep range is 30, 15, 15, 15. So we do 30 reps the first set, then 3 sets of 15. With an isometric like this, I like to do 3 sets of 10, especially this is about a 4 to 5 second isometric. So how many you had, Austin?
I didn't count.
Okay, no counting, but let's say that's 10. So little break. I give them a 30-second break, and then after a 30-second break, we'll go into another set of 10. Let's go ahead and jump into another set of 10. For the purposes of this video, we're going to speed it up for you guys. Okay, so now we're going to go into our tricep activity exercise. Same band, but as you see, we got other colors down here. We got red and yellow. If we have to drop down, we will. He's going to go out into a lunge stance or even a split stance. Elbow as high as the shoulder, chest up, palms to the ear right now. So for lefty, which is what he'll be doing, palms to the ear. Here, he's going to extend and thumb to the ground. Thumb to the ground. It's not drop the elbow. The elbow's got to stay in the same spot roughly. It's a rotation of the forearm at the end, and then elbow extension. So we'll start with green band. If he can make it through the 30 reps, that'd be great. And we may have to drop him. At any point during these exercises, you can drop down to a lighter color. Go ahead. And you can already see how vasodilated this arm is, how much blood is pooling in his arm. And that's because we've occluded blood coming into a certain amount, but we've stopped blood from leaving the extremities. So instead of working on a mechanical overload, we're working on a metabolic overload. And there's a lot of people that have different opinions on it. We've seen it be very effective in our post-surgical patients and in our acute injury patients or somebody that's coming off of a chronic injury. Like I said, we don't use it a lot besides recovery in our very healthy guys, just because they can mechanically load their tissue with more tensile load than, you know, another athlete who has injury or has some sort of ulnar collateral tearing, medial epicondylitis, something like that. And I want to make sure with Austin, we're going to go a little slower on the eccentric. So if you're instructing, you know, your athletes, I always like to give them, and what I've seen historically work the best is a 3-second eccentric lower on a lot of these. And I really like to do the biceps isometrically because it functions as a stabilizer during the throwing motion, as well as other overhand motions too. Your tennis racket, those things. The triceps will function very much eccentrically at different points in the throw, as well as different points in a volleyball serve and a tennis serve. So focusing on that eccentric here, we'll go 30, 15, 15, 15. For the purpose of this video, we're going to speed it up here for your guys' sake, and then we'll get into our forearm exercise. So now we've done our bicep training and our tricep training with the blood flow restriction device. We're going to go into our medial forearm training. And this is typically our bat drill. So if you have a bat, golf club works too. Golf club is actually great for this exercise here for him with the blood flow restriction cuff on. Because he's occluded, he's going to have to go at a lower percentage of his maximum. And a lot of times the bat, especially if you get into a heavier wood bat or a drop 3 bat, is, it's heavy. So dropping down into, a golf club here, we got a 7-iron. But I'm going to have him start with the palm forward, go through the exercise, palm into the pocket, bat back, and then palm into the pocket, bat out, or club out. Those three. And we do have more for the lateral forearm that we're not going to go through in this video. Come more across your body right here. And so he's keeping his pinky tight. He's keeping all of his fingers tight on there. Try to not use that thumb. So right there, he had a little cheat, lengthened his lever arm with that thumb there on the club. And I'm having him do as much of a hinge into ulnar deviation as possible. Hitting that FCU, a little bit of the pronator there because he's biased into supination. So that proximal portion, and really trying to squeeze up into it. And the same thing applies here. For this one, because we're going to hit the muscle in 3 different ways, and that's all going to hit medial forearm and forearm flexors, that we're going to actually only do 15 in each direction. So you could do multiple sets too. So he'll do 15 that way, 15 with the palm in, bat back, and you can see his wrist is nice and flat. So there's no extension in the wrist here. That's perfect. It's not an elbow flexion extension exercise. He's keeping it nice and stable, which is what I want my athletes to do. And depending on what the athlete presents with, I can do more or less. I can do more resistance, less resistance. Have them choke up. You know, they're still having a little bit of twinge. Have them choke up. Do 2 sets with it choked up, and then they get a positive stress reaction. So, you know, I manipulate how I do the exercise to be specific to the athlete and what they have going on. A lot of times we see that tricep is really weak, the bicep is weak, and then that medial forearm. So this one will hit more of the posterior fibers here. The posterior medial fibers of the forearm. And you can see it's a nice, perfect hinge, pinky's tight. And I like a nice controlled descent eccentrically. And if you just look at Austin while he's doing this exercise, look at the difference in arm color here and here. You know, that's one of the effects of the blood flow restriction training. But with Austin, if I was going to have him use this golf club without this cuff on, I'm going to have to put a cuff weight on there. He can get extremely fatigued using just this club with no cuff weight because of the occlusion. So great modality, great tool. We love to use it with our throwing athletes. And there you have it, guys. Please subscribe to the channel. Like this video if you like this content. We're planning on releasing another one on recovery training, so something I might use after an athlete has thrown a lot. We just had athletes going through high school tryouts out here, so you know, after an athlete goes through tryout and they're a little sore, some of their recovery tips and usages of the blood flow restriction cuff with those athletes as well. So give it a thumbs up, subscribe, and hit the bell so you don't miss any of our future videos. Thanks, guys.